So what are the key health issues through this election campaign?
So, Joe, look, the announcements so far have been pretty piecemeal. You would have thought by this time in the campaign we would have had more health announcements. Most of the announcements have been due to the cost of living pressures. So, probably the biggest announcement and both parties have said that they'll do this, is reduce the cost of medications on the pharmaceutical benefits scheme. So, the coalition have said that they'll reduce it by $10 and then Labor by $12. Then some really missing is a plan by either side on how to really tackle the sort of key reforms that the health sector wants going forward. You can see here we've got, the coalition have announced the rural workforce initiatives. The ALP have said that they're going to set up these urgent care centres. The coalition have also promised to have telehealth as a permanent feature. And then Labor has said that they'll have more support for overseas trained doctors. There's been also on the weekend, the coalition announced some support for postnatal care, and Labor just today has made a big announcement about Flinders Hospital with the state government over there. But what's interesting, Joe, given we're in the middle of just coming out of a pandemic and health has been such a massive topic that we've all been focused so greatly on, it's really quite surprising that we haven't seen a really, sort of structured plan on how to move forward with our health system, because the pandemic has showed us that the health system is under so much pressure already, and the pandemic has just exacerbated that. And there's a couple of things that the health sector is really calling for that we haven't seen from either side so far.
And so what are some of those really important issues as far as the health sector is concerned?
There's two. First of all, it's primary care. When we get sick, most of us, the first place we go to is our GP. And what has happened is there's been more and more pressure on general practice. And people are having to go to allied health things like, say, a dietitian or a podiatrist or a psychologist, and then you as the patient has to coordinate all that. But what the AMA and the Consumer Health Forum want is a system where the GP would be the centre, where you'd go to your GP practice, you would sort of sign up for a practice, and then the GP would coordinate all those different services for you. So you wouldn't have to, as the patient, try to navigate the system yourself. The GP would sort of help steer you through what you really need. And that's what they're calling for in that respect. The other thing is to alleviate the pressure on...
For a second, doesn't the ALP policy on the urgent care clinics address that to an extent?
No, not really, because the urgent care centres, they're based on a New Zealand model, and it's designed to keep people away from emergency departments. Whereas the primary care model that I just mentioned is really designed to be more preventative. So it would stop you even needing to see, say, a specialist, or definitely ending up in a hospital department. So by focusing the spending much earlier in the process on prevention and on good primary care, the idea would be that you wouldn't need to go and see a specialist. You wouldn't need to be in an emergency department, because your health condition would be better managed in the community, not in a hospital where people don't really want to be in hospital anyway. And that's the second part of the system that's really missing. At the moment, there's a split between the states and the federal government on managing the public hospital system. The states want that to be a 50-50 split, and at the moment it's 55 states and 45 the federal government. And neither side have said that they'll agree to that at this point. But the states are really desperate to say, look, the public hospital system is really struggling under the weight of the pandemic, and we see so many doctors and nurses really struggling to keep up with the demand. And so that's something that's really missing as well, a really structured and sort of detailed look at how we're going to tackle the pressures on our public hospitals going forward. And, we've got a couple of weeks left in the campaign, and so I'd be hoping that these are some of the issues that we will see more announcements of, but it's certainly something that voters should be asking their members or their local members or their prospective members how they're going to tackle these issues, because we've seen how important health is, and these are some of the questions we don't have answers for yet.
And Sophie, so what would be an example of a policy announcement that would address that first issue you mentioned there on the need for attention to primary care? What sort of things could the federal government do in that sector?
So it's all to do with the way Medicare is structured. So it would need to have a revamp of the Medicare system. At the moment, we have what's called a fee-for-service model. So you go to the doctor, you get paid, he or she gets paid for that service. We need to have a legislative change to Medicare. And so that would mean the party would need to say, we're going to look at Medicare, we're going to see if we can make some structural changes so that doctors do have the ability to more actively manage your care in the primary sector, which is where people want the help. They want that coordinated care from a GP all in the one place, and that would be ideal, but we would need to make some legislative changes to Medicare to make that happen.
And Sophie, you've been the ABC health reporter for quite some time now. Have you noticed in previous campaigns that there has been a bigger picture approach from the parties to health or not?
Look, sometimes there have been some bigger announcements made in a campaign. I think Labor is being obviously very cautious about making any big announcements early on. But I think we will see, and certainly when we've spoken to both the parties in the stories we've been doing, that we will see more health announcements as we get closer to the election day. And certainly Labor likes to be known as the party that created Medicare, and I wouldn't be surprised if we do see some more health announcements from Labor. But I am surprised, given just how much of a focus we've had on health the last few years, that we haven't seen more on health. You know, there was a brief mention last night in the leaders' debate about the handling of the rollout of the vaccine, but I'm really surprised that people aren't asking more questions about what the parties are going to do, given we know the pressures on the health system. We know how people are really struggling to just deliver services now, and it's only going to get worse with an ageing population. So I'm really hoping to see some more announcements, and that particularly that focus on primary care, because that's where we...
As to why it hasn't played a bigger role so far?
You know, people's hip pocket tends to drive voters to make decisions, and I think both parties are recognising the cost of living pressures, which is why we've seen the major health announcements to do with the cost of medication. So I think people think that you'll get healthcare regardless, but it's the cost of that healthcare. And people know, like the Consumer Health Forum have said, that people are putting off paying for medications because they can't afford it. They need to pay rent, they need to buy food, so they're putting off buying medications that they need. And so certainly the cost of prescription drugs is an issue, but I'm really hoping that we do see some bigger announcements, some more structural change, because we know that there are some major reforms that are needed. And what we've seen so far are really sort of quite piecemeal little announcements here and there. And so fingers crossed that we do see that focus on primary care and prevention, because the reality is if we can prevent these illnesses in the first place or stop people getting sicker, then you won't need to go to hospital, and you won't need to have, you won't have ambulances waiting to get people into emergency departments. So we need to shift the focus to prevention and get people the good primary health care that they need in the community, which is where people want the health care.